All right. So welcome everybody to our 2026 annual meeting for Brain Injury Association of Ohio. And I just want to spend some time today kind of reviewing 2025 and what we had happen in that year, kind of what we look forward to in 2026, and then a little bit of board business at the end. So just to kind of reorient everybody as we look at our activities of the last year and future years, our mission really is to create a better future through prevention activities, research, education, advocacy, and services to create a better future for survivors after brain injury. And we really try to do that through providing resources and supports and services. So some impact highlights of our 2025. We increased our support services to brain injury survivors through personalized care, resources, and community connections. We did a lot of advocacy efforts in 2025, which I'll talk a little bit more about. And we really got out and provided education to the community and to professionals and legislators throughout the year. So our signature service that is definitely our most accessed service and our service that has run for all of the years of our existence, it's the only service that's run through all 40 plus years of existence, is our helpline. And so this is where people reach out to us either by phone, email, or a web form, or they encounter us through clinics as well. And this is how people get information, resources, and potentially long-term support. This service is accessed by people everywhere from just, I need the name and number of a personal injury attorney, and we give them the name and number of a personal injury attorney, and then they're done with us, all the way up to people that need much more long-term support, and we're helping them do things like find housing or, apply for disability, or helping them get in-home supports to make sure that they're safe at home, and everything in between. So this is kind of an exciting little graphic here where we can look at the number of individuals that have accessed our helpline services over the course of the years. So you'll see that in 2022, we had 181 contacts to our helpline. In 2023, we had 513. So definitely more than doubled our awareness there. And then in 2024, it went up to 776. Again, substantial growth. But this past year in 2025, we made it up to 1,656 contacts to our helpline, which shows that we are really getting the word out there about our programs. And some of the things that I hear from people in the community is that not only are we getting the word out, but we're really providing a quality program. And so they really are eager to refer people to us, which was not necessarily the case when we, were maybe not having paid staff and not having a robust program. So that is a testament not only to our ability to get the word out about the organization, but also for the team that delivers these services. They're doing a great job. We also, one of our longest running programs is support groups. So we provide support to support groups throughout the state of Ohio. And they're a vital part of how we help survivors reconnect with their community and have some validation and understanding in their experience. So we track attendance across the support groups that we partner with. And in 2024, there were 580 attendees to support groups. And in 2025, there was 1,156. And that's even with us losing a few support groups due to some different changes within, their group facilitator structure. We're noticing that people are returning back to support groups. We had a period of time where they weren't necessarily the most access service we have, but we are seeing that increase. And we are always looking for more places to have support groups and people to partner with, because there are definite gaps across our states when it comes to the availability of them. As part of this year of growth and innovation, we ran our second NeuroSparks event this year at Cleveland State. Truly one of the most amazing things that we do. We are able to work with survivors and caregivers over a 3-day period and provide intensive support through assessments and treatment with physical therapy, occupational therapy, speech therapy, amongst other disciplines as well. And we are able to work with folks to create very personalized plans for them to use at home to help them continue on their rehabilitation journey. And we provide everybody with a free iPad at the end, loaded up with apps that are necessary for them based on their clinician's recommendations. And it's a great way to bridge gaps in care because as we all know, a lot of times when a survivor first leaves an inpatient facility and goes home, there's some supports. They're getting outpatient therapies, they're getting some services. And then after a period of time, due to insurance restrictions, due to transportation, due to access to care, those things kind of wane off and people really lose some of that rehabilitation support that they need. So this is an opportunity for us to help in that plateau area where those services drop off and people need a boost. And we've seen some great success with that. This year, we plan to, in 2026, add at least one, if not two more sites. We are engaging in a partnership with the University of Cincinnati. And we are also in conversations with Ohio State University as well. We also launched another new program this year called Together We Thrive, which is a great workshop for caregivers and survivors to work on communication and emotions after injury. We all know after a brain injury, roles change, the way we interact changes, and that's oftentimes a source of frustration for brain injury survivors, and it's often a source of frustration for brain injury caregivers. And so we developed this program as a way to work together with survivors and caregivers on how to really repair any changes to those roles and help them learn to communicate better together, to manage emotions, and to really heal some of those changes that happen after injury. So we did our first session in the fall of 2025, and we have some community partners that have requested we bring it out to more areas of the state in 2026. So stay tuned. Those will be announced probably in the spring. And as I mentioned earlier, one of the biggest things we did in 2025 was an advocacy focus. And, we are always trying to promote policies that support brain injury survivors and their caregivers and make sure that they have the best access to care and that their ability to live well in the community is preserved. And we also use it as an opportunity to raise awareness about brain injuries in Ohio because many people don't think about brain injury until they have to think about brain injury. And so we really are always trying to keep brain injury at the top of minds with legislators. And then we are also, in those advocacy efforts talking about the need for funding. So prior to 2025, we were the lowest state in our peer states as far as funding, getting only 5 cents per resident towards brain injury funding. The next highest was Pennsylvania at 42 cents, so more than 8 times per person what we were getting in Ohio. And we had some great success in our advocacy efforts. So I'll just forward to that. We had some great success. We were able to secure an additional $250,000 per year in state funding for brain injury services. A portion of that went to the Ohio Brain Injury Program, and then a large portion of that came to BIOH to increase access to services. And this now means we are not at 5 cents. We are now at 7 cents per person in the state of Ohio. We are still by far the lowest, but we have made a little bit of headway there. We are really grateful for the funding that we received in today's funding climate. $1 more would have been a win, and we definitely got more than $1 more. And so we are working to be really good stewards of those dollars and to use them to expand programming across the state, which I think you will see when I start talking about 2026 efforts. some of the new initiatives that we're going to be launching. So in 2025, we really worked to cultivate and nurture some relationships and partnerships. And so we created a regional partners network. And you'll see there's some logos there on that slide of who our regional partners are: the Brain Injury Health Collective in Dayton, Hanson House Clubhouse up in the Cleveland area, Northeast Ohio Brain Injury Foundation that kind of covers the whole northern area, and the Traumatic Brain Injury Resource Center in Toledo. So we've been working with these regional partners to really talk about how we can support each other, how we can partner with each other in work, how we can make sure that we are a unified voice in the state of Ohio around brain injury. And we're also investing in each other. So we did put out in 2025 a grant proposal, or a grant open to grant, to our regional partners, and allowed them to apply for funding to do some programming. This was using some of those state dollars that I just talked about that we got, and passing them down to community partners to get community level programming engaged across the state. And so we are excited to be awarding those grants and seeing some more local community projects come out of that. And we also partner with many hospitals and community organizations, and we've been working to expand those as well. So looking ahead, again, we've got this this increase in money that we are looking to invest into programming to help survivors. We want to expand awareness so that people know about brain injury and know about our services, really, and expand our programs as well. So in 2026, our first priority is to maintain and protect the things that we've been doing. Again, that neuro resource facilitation that we do through our helpline, we're going to continue to offer that and look for ways to expand it. One of the ways that we will be doing that is by offering more backpacks to more hospitals across the state with the funding that we received, and that will allow people to get connected to us earlier in their brain injury journey, and so that we can provide support to them in those early days when it's most critical. We are also going to continue to work to expand that support group network by trying to get more groups developed throughout the state. We are going to continue Healthy Minds programming and work to bring NeuroSparks to at least one more region this year, if not two, as I mentioned. Again, adding more Together We Thrive workshops this year, that workshop for brain injury survivors and caregivers talking about communication, partnering with more in-person clinic sites, and increasing training opportunities. So that's just a little overview of some of the things that we're already doing that we want to just continue to increase our ability to do them throughout the state. And then we have some programs that are going to be brand new that we're launching. One of those is a renewed Return to Learn initiative. So there was a great Return to Learn initiative led by Dr. Susan Davies several years ago. Unfortunately, it happened kind of near the time of COVID, and getting people to implement them in the schools was challenging. So we are grateful to be partnering again with Dr. Susan Davies at the University of Dayton, as well as Dr. Lundeen at The Ohio State University, and some other partners at Case Western and Nationwide Children's, to be creating a Return to Learn program that we think will have more successful implementation. So this was a program for K through 12 students who have had a moderate to severe brain injury, and we have brought on board a school psychologist who will work with our certified brain injury specialists already on staff, and they will work to bridge gaps and help coordinate care between the rehab team, the school, and the family to make sure these kiddos have the best possible outcome. So this is launching early this year. We have limited space given the amount of funding that we have available to donate to this, but we are also seeking additional funding opportunities to expand it, because we really want, within the next 5 or so years to have this available to any kid in Ohio. So this is a really exciting thing that you'll see us starting to promote here in the next few months. And we're excited to be bringing this service to kids across Ohio. Another program that we are launching, it's actually going to be launched within the next week, is our Empower Path program, where we are partnering with the Ohio Domestic Violence Network and a couple of their domestic violence programs to bring brain injury services directly to their survivors. So this is kind of a new model of that backpack program that we've been doing in inpatient facilities. And this is where a survivor that encounters one of these domestic violence programs will be provided with a little package with some helpful tools in it, but also a consent to be connected with us and to get some neuro resource facilitation. And that, again, is that service where we'll help them navigate benefits, help provide them resources in their community, and help them navigate the brain injury part of their journey. So we're very excited to be doing this. We've been part of the cost collaboration with the Ohio Domestic Violence Network and the Forensic Nursing Network for several years, and we've been working to connect those worlds. But I think this is a program that's going to provide that seamless connection even better for survivors to be able to access services. We also launched our Caregiver Connection Retreat this year. Our retreat is April 17th through the 19th. There is no cost for a survivor or not a survivor, a caregiver to participate, but we do collect a registration deposit that we refund the day of the event. And it includes lodging, meals, and activities. We're going to be doing things like yoga and hiking and education and just time to relax and connect as well. We've had a great response to this program, and actually the overnight spots are currently sold out. There's a wait list you can join, and there are daytime spots available. So if you just want to come on a Saturday and partake in some of these activities and connection, that is still available. But we are really excited to be offering this very caregiver specific activity this year for the first time. We also launched this year, we actually already started a couple weeks ago, a new program called AHEAD, which is Achieving Healing Through Education, Accountability, and Determination. And this is a curriculum that MindSource in Colorado puts out that we have adapted and kind of tweaked for our utilization. And we cover a different topic each week. It's a 6 or 7 week virtual program. And we work with survivors to better understand their brain injury. We talk about memory skills. We talk about regulating your emotions, communication, anger, and really pausing to think before reacting. And so we've just, like I said, started our first session of this. It's free to attend. And it acts as a great educational opportunity for survivors to get some skills and tips and tricks to manage some of the most challenging parts of their brain injury journey, but also it offers opportunity, a chance for folks to connect with others that have had a similar situation. It acts as a little bit of a support group as well. So that's been a great program, and the registration for the next session is open on our website. It'll be starting in April. We will be hosting, again, Advocacy Day this year on March 12th at the State House. We're really excited this year to be able to go meet with our legislators and thank them for the funding that we received last year, as well as talk to them a little bit more about brain injury in Ohio. We have a unique opportunity this year also as part of Advocacy Day. So we will do our traditional format where we have a breakfast reception in the morning, and then we have meetings with legislators the rest of the day. If you're interested, we schedule those for you. But this year we are also offering a video opportunity, and that will be if you are a survivor or caregiver and you would like to register for it. It's in that same registration you're going to fill for Advocacy Day out. And we are going to be taking videos of survivors and caregivers answering a few questions. And these are questions aimed at helping others understand brain injury, the challenges of brain injury, and why they should be paying attention to brain injury. So if you would be interested in that, you can sign up on the Advocacy Day registration form. We will mail you the questions ahead of time, so you have time to prepare your responses. And that'll just be an additional slot in your day that we'll schedule for you. For all participants of Advocacy Day, we are again doing a virtual training. That'll be on February 19th. And the registration for that is on the same page as the Advocacy Day registration, so you can register for that as well. And we will be recording that training in the event that you wish to partake in that but can't attend in person. So lots of ways in 2026 for our members to engage with us. And we just wanted to highlight a few of those. Again, join us at Advocacy Day. It's a great event where we all come together across the state to share about brain injury and tell our stories. And I think that's a really impactful event, not only for the legislators that we're talking to, but also for those that participate as well. You can join us at the Caregiver Retreat. We also will be having our Cerebration Walk, Roll, Run events in the fall. So stay tuned as we release those dates. Those are another way to get engaged with us and to really connect with the survivor community. And then in the last quarter of this year, we will have the Ohio Brain Injury Summit. So we encourage you to join us for that as well. Another great way to connect with us is to volunteer. We have lots of opportunities for folks to volunteer in all different ways and capacities. And it's one of the ways that we are able to really expand our programming is by partnering with volunteers. So if you are interested, there is a link on our webpage to inquire about that as well. And then to stay connected so that you kind of learn throughout the year what's going on, when new activities and new events are scheduled. You can sign up for our email newsletters and our socials, which I did put. If you have not already subscribed to our email newsletter, there's a QR code you can scan and do that. That is a newsletter we send out monthly that has all of our upcoming activities, any news that's coming out about brain injury, and it's really the best way to stay connected. And so I encourage you to sign up for that if you have not. And the second best way to stay connected is to follow us on socials. And so the three that we most frequently use would be Facebook, Instagram, and LinkedIn. And if you just find Brain Injury Association of Ohio on those three socials, you can connect with us. And that's another way that we like to share information frequently. So encourage you to check that out as well. So the little bit of board member business that I shared in the beginning that we needed to talk about, as part of our annual meeting, we do include board election. And so while we do not have any board members currently coming off of term right now, we do have two new board candidates that have been nominated. And so we are going to be voting on their membership to the board. So as a member of BIOH, if you are a registered member, you will be receiving within the next week an email from me with a ballot to vote on those two candidates. And so we ask that you submit your ballot and return that using the electronic form. So it's the same form that we used last year if you participated in voting last year. Voting remains open for 15 days from the date the ballot is sent. So if you could get that back as quickly as possible, that would be wonderful. And then after we close the voting period, those results go to our board, our current board, and they will review the submissions and finalize any appointments following that review. So again, within the next 7 days, you're going to get an email from me if you are a registered member of BIOH and you can vote for those two candidates. And then I just really wanted to take a moment to say thank you. We've had a tremendous year, in our advocacy work. We've had a tremendous year in growing partnerships and programming. And it truly would not be possible without everybody throughout the state that partners with us, whether you're a member, whether you're a clinician that's referring to us, whether you're a university helping us to host programs, whether you're a regional partner, helping us to bring a more unified voice in Ohio, whether you're a funder supporting financially the work that we're doing, or a volunteer helping us to execute all of this work, we truly couldn't do it without all of you. And I'm really grateful. And I know our board is really grateful, and our survivors and caregivers that we work with are really grateful that we are able to continue in this path of innovation and growth due to all of these relationships. And so, thank you for all that you've done to help us do this. You are the reason that we've had a successful year. And so we really need to make sure that you feel that appreciation. And that is the total content that I have for today's annual meeting. For those that are attending in person, I will just ask real quick if you have any questions. All right, it looks like we.
Hey, I do just want to say thank you to you. I mean, a lot of this progress has been made to a lot of hard work that you've done. So we really appreciate your leadership around this and helping to give guidance to the board as well as to the team members. So thank you for all the work that you do towards this.
Thank you so much. Thank you. I am grateful for the opportunity. It's been a great adventure for me. So thank you.
Great.
Any other questions or comments or? All right. Well, without further ado, I will go ahead and wrap this up then. Um,